The NCSBN Clinical Judgment Measurement Model, CJMM, is crucial for the Next Gen NCLEX, NGN, focusing on real-world decision-making. Mastering its 6 functions enhances clinical safety and exam performance. We'll define each function and apply them to a case, ensuring a comprehensive understanding of their application in clinical scenarios. The 6 functions of clinical judgment are essential in practice and are explicitly measured in NGN case sets. They include recognizing cues, analyzing cues, prioritizing hypotheses, generating solutions, taking action, and evaluating outcomes. Each function is critical for effective clinical decision-making and patient care. Our unfolding case involves a 67-year-old with COPD, pneumonia, and diabetes. The client presents with dyspnea, a productive cough, and confusion. Orders include oxygen, IV antibiotics, labs, and continuous pulse oximetry. This case will illustrate each CJMM function with focused examples. Recognizing cues involves identifying relevant clinical data. Key questions include identifying abnormalities and new trends. In our case, low SpO2, tachypnea, fever, and hypotension are critical cues. Immediate actions include escalating oxygen needs and considering sepsis triggers. Analyzing cues requires interpreting patterns and pathophysiology. Consider ventilation, infection, and perfusion. In our case, fever, productive cough, and hypoxemia suggest pneumonia with possible sepsis. CO2 retention in COPD is a risk, necessitating careful oxygen titration. Prioritizing hypotheses involves ranking problems by likelihood and risk. Address the most dangerous issues first, such as airway and circulation. In our case, hypoxemia from pneumonia and sepsis-induced hypotension are top priorities, followed by hyperglycemia's impact on recovery. Generating solutions involves identifying evidence-based interventions. Match solutions to hypotheses and patient context. For our case, titrate oxygen, obtain blood cultures, and start IV antibiotics. Administer IV fluids for hypotension, following sepsis protocols. Taking action means implementing the best option safely. Verify intervention rights and communicate using SBAR. In our case, apply a Venturi mask, draw cultures, and initiate antibiotics. Begin isotonic bolus if ordered, and start the sepsis protocol. Evaluating outcomes involves judging responses to actions. Decide whether to continue, escalate, or modify the plan. In our case, monitor SpO2 respiratory rate and MAP. If hypotension persists, notify the provider and consider vasopressors. Reassess mentation and urine output. Mapping CJMM to the nursing process involves aligning functions with assessment, diagnosis, planning, implementation, and evaluation. Use CJMM verbs in care plans and handoffs. Practice with unfolding cases to build fluency and ensure effective clinical decision-making. The NGN measures CJMM through case sets aligned with the 6 functions. Standalone items include bow tie, trend, matrix, and highlight. Partial credit scoring reduces penalties. Strategies include reading stems for cues, answering in CJMM order, and eliminating distractors. High-yield cue recognition focuses on critical signs like airway obstruction and severe hypoxemia. Red flags include new confusion and chest pain. Prioritize trends over single values, considering baseline and trajectory to ensure timely and effective interventions. Prioritization frameworks align with CJMM by using probability and severity matrices. Safety first. Address acute before chronic issues, and unstable before stable. Anticipate what will cause harm first, ensuring patient safety and effective clinical decision-making. Generating solutions safely involves matching dose and route to physiology. Prioritize time-critical interventions like antibiotics and glucose for hypoglycemia. No antidotes and rescue medications for high-risk therapies to ensure patient safety and effective treatment. Taking action requires effective communication, delegation, and handoffs. Use SBR tied to CJMM, delegate within scope, and keep RN-exclusive tasks. Close the loop with repeat back and prompt documentation to ensure clarity and continuity of care. Evaluating outcomes involves setting explicit targets like SpO2 and MAP. If targets are unmet, reassess cues and update hypotheses. Document rationale and link to new orders, ensuring a responsive and adaptive care plan for optimal patient outcomes. In a practice mini-case, apply all 6 CJMM functions. For a post-op patient with elevated heart rate and calf pain, Walk through cues, develop hypotheses, generate solutions, take action, and evaluate. Justify each step using CJMM verbs for clarity. Teaching with CJMM involves using unfolding cases and requiring students to label each function. Score with analytic rubrics aligned to the 6 functions. Debrief with scripted prompts targeting cue selection and hypothesis quality to enhance learning outcomes. Key takeaways include CJMM's role in safe clinical decision-making for practice and NCLEX. Think in verbs. Recognize, analyze, prioritize, generate, act, and evaluate. Practice with case sets, justifying every choice with pathophysiology to ensure comprehensive understanding. For further reading, refer to selected references on CJMM and NCLEX test plans. These resources provide in-depth insights into clinical judgment and decision-making, supporting your understanding and application of the CJMM framework in clinical practice.